you could, that'd be very helpful.
Oh, he's giving me the single. Okay. I want to start by saying we are wearing our masks, but we're not wearing the masks while we're speaking, because the purpose of this is to communicate with the public, and it's a little difficult to do that with your mask. But we are observing all of the rules about wearing masks here in the courthouse. So, real quick, we each have a little something for you guys today, and then we'll take questions at the end. The numbers: we have tested 328 individuals in Lewis County. 11 of those individuals have tested positive for a positive rate of 3.4%. The governor is now talking about positive rates and rate of infection. So in Lewis County, that would be 3.4% of tested. 8 have recovered of the 11 that were positive. So that means we still have 3 in isolation, and we have, of course, still luckily have 0 fatalities from COVID in Lewis County. The governor is beginning to talk about reopening and what that would look like, and he's outlined some criteria that Lewis County does very well in. There's 12 points that the governor has outlined. We do quite well in those, each aspect of the governor's 12-point plan. We're all looking forward to the day when we can get back to some semblance of normalcy. The first, I'm not going to run through all 12, but basically, it's about 14 days of reduction in hospitalization. Well, we haven't had, we had 2 hospitalizations a month ago, but other than that, we've been in good shape in that category. Healthcare capacity, I know Jerry can touch on that with, available ICU beds. We have no problem, with healthcare capacity in this community in terms of the governor's standards. Tracing, the governor wants 30 tracers for every 100,000 people. If you take that ratio and plug it in for 27,000 people in Lewis County, that means that we would need 8 tracers. We have 8 tracers. We have Ashley's department, and we have other people at the county that have been trained to do contact tracing, so we're fine in that category. The one category that is going to hold up Lewis County, and it's going to hold up every place, is testing. The governor says that he wants 30 tests for every 1,000 individuals every month. So 30 tests per 1,000 people every month. That means Lewis County would have to do 800 tests a month. Well, obviously, over 2 months, we've only done 328 tests. So it's not that we don't have the capacity to do it. We can ramp up tomorrow. We don't have the equipment, the swabs, to do it. And I think, we can get into more of that. I think Jerry and Ashley can speak to that more. Mass distribution, in the meantime, I know everyone's looking forward to reopening and hoping we can get there, but in the meantime, we are still supposed to be observing social distancing. We're still supposed to be washing our hands, doing all those smart things that we've become quite good at here in Lewis County, and we are still distributing masks. So this week we've been to Lowville, Port Leyden, Croghan, Harrisville, and there is still one more opportunity to get masks tonight at 5 o'clock. We'll be at the Lowville the Lowville Walmart parking lot, distributing masks tonight at 5 p.m. When you're in public, you should be wearing a mask if social distancing cannot be observed. We will continue to distribute masks into next week as long as they keep coming in, as long as the donations keep coming in. We'll keep distributing our masks. So we've done a great job distributing masks. I'm very proud of our county team and very proud and thankful for all the people that have taken the time to sew masks for the community. It is very, very helpful, and it's just an awesome, that's what Lewis County does. It's great. So that will wrap it up for me today. We'll turn it over to Jerry for an update on some things regarding the health system, and then Ashley is going to speak a little bit about antibodies, and then we'll take questions. So go ahead, Jerry.
Okay, thank you. I have 3 reports today. The first, Ryan asked for the ability to have more testing. I'm happy that we're going to be able to deliver. We have ordered the CFED Gene Expert system, and it's a system that will allow us to do same-day COVID testing with a quick turnaround of 30 to 45 minutes. The device has been ordered, the analyzer has been ordered, and we are expecting it the week of May 11th. So we're pretty excited about that. Now clearly you just don't get up one day and then buy one of these machines. Our laboratory director has really been like a dog on a bone on this one, working hard since this whole outbreak began, and was able to finalize the purchase last Friday. So the unit's been ordered, and so questions I've already had are, is it in your budget? No, it's not in my capital budget. However, the way capital budgets work in our setting, we have a $4 million capital. It will replace something else. It's about $63,000. We anticipate, based on the additional tests this analyzer will be able, that this analyzer will allow us to do. In the first year, we'll generate $65,000 worth of revenue. So essentially, it becomes a break-even purchase for year one, and then actually generate some revenue for us, and we can expand on the tests that we do. So this is great. One, so that if someone is identified and they need a test, they don't have to be put into quarantine while waiting for the results. Two, as we gear up to do surgeries again, we need to be able to test every single person who will have a procedure done. And three, this allows us in the not too distant future to partner with public health so we can get into surveillance testing. And once public health and Ashley and her team get the guidance, we will really collectively and in partnership serve the county residents. So we're pretty excited about that. Next update is this morning we received the latest guidance where we might move towards elective surgeries. Keep in mind, on April 21st, we were told that we would be able to do elective surgeries on the 28th. Both mentioned in the governor's press conference and then a media briefing identified it. Then on Monday, early afternoon, we were told, hold the presses. You hadn't received the guidance yet, and we just received the guidance this morning. And if you sense a bit of disappointment, we had a number of patients scheduled for surgery on Tuesday, and we had to call and say, we're not going to be able to do it. So the guidance has arrived, and receiving guidance from the Department of Health is truly helpful because it begins to shape the framework in which we can engage in the next thing, right? However, guidance is never clear on round one because many of the paragraph and words leave themselves open for interpretation. So we're now in the clarifying period. So before coming here, earlier this afternoon, I sent a number of clarifying questions. Because one, we want to do it right. Two, we want to follow the guidance, and we do not want to be out of compliance. We want to be a compliant organization. So the question I've received already a half a dozen times this morning, when will we begin surgeries? I can tell you, based on the guidance and the things we're going to have to demonstrate, it will not be this week. And at best, at the earliest, I think will be the end of next week because of all the steps we have to ensure and the attestation documents that I must sign, that sort of thing. The good news is we're at least we have guidance and we're moving forward. Lastly, I just want to give an update on the nursing home. If you've been following the news, in many areas, nursing home deaths are accounting for more than 50% of the deaths in a region. And as you know, we operate a nursing facility in our health system called the Residential Healthcare Facility. And I just want to express very strongly my deep appreciation for the CNAs, the nurses, nursing leadership and administrative leadership, and our infection prevention specialists. They have just done a wonderful job. our nursing home has not had the experience that you're reading about in the news. We were very early adopters to some important measures to keep the residents, the people who call our facility home, safe. And we didn't do it alone. I mentioned the staff, but the residents have been very gracious in working with us, as well as their families. Imagine if you have somebody in a facility like ours. We're approaching 2 months where you have not been able to visit. It takes a great deal of trust in the facility, which really means a great deal of trust in the staff. The team has done a wonderful job there. They're working with the families to create, use technology for, like FaceTime visits and those sorts of things. We've had window visits and many updates from the leadership there to the families, keeping them informed. So just, my thanks to the families for just how supportive they've been and working with us and helping us keep their family members safe. So, knock on wood is appropriate here. A lot of people have worked hard, and they continue to do the right things, and before long we'll be able to let family members come back. We just need a little more time, but just my thanks to the families, to the staff, and to the CNAs, to the nurses, and the administrative team. They've done a terrific job. Great. Go ahead.
Great. So I'm going to talk a little bit about the testing. We've gotten a lot of questions in regard to expanded testing, antibody testing, and I want to let everybody know that all of the testing that we have done thus far has been in partnership with the health system. They've really done a wonderful job with standing up the Call First clinic. We've certainly met the need thus far for individuals presenting with symptoms in need of testing. So to date, we've done a wonderful job. With that being said, we certainly need to ramp up to meet the governor's quota, and we do plan to do that. They have expanded somewhat who is allowed to be tested, knowing that we must still prioritize symptomatic individuals based on the testing supplies that we have. With that being said, there's 2 types of testing. There's the diagnostic testing, PCR, which we've been doing to date. There's also the antibody testing that there's been a lot of media coverage in regard to. So I wanted to speak a bit about that and exactly what that means. So there's 2 types of antibodies that we test for. There's IgM and IgG. IgM is present when there is an active infection. IgG develops approximately 3 to 4 weeks after somebody has had the virus. There's been a lot of controversy in regard to the antibody testing because ultimately the PCR is the gold standard for the test. There's a lot of tests out there that are not approved by the FDA to use. We have, I should say, the hospital has worked very hard to find a good test out there that is approved by the FDA and actually has shown to be 99% sensitive and specific for COVID-19 specifically. Other tests could mistaken other coronaviruses when they're performing the antibody test. So it's very important that we got a good test. We have more guidance from the state in regard to how we interpret those results, how we report those results, and so that is the piece that we were waiting for from a public health standpoint. So we're looking at bringing this to Lewis County. We have guidance in regard to who should receive that antibody testing. So anybody who we would be reaching out to the appropriate essential workers and organizations that would need that testing. But so we ask that people be patient, and there will be more information, and we will communicate that to to those people that need to know. Let's see here. I think that's all I had. Can I do that?
Ashley, I know we didn't talk about this, so I apologize, but we have had some businesses who have said workers can't come back until they get an antibody test. Can you talk to the appropriateness of those types of things, and what should businesses be, what should businesses know regarding the antibody testing?
So if that's the guidance that they've received, they should work with us at Public Health and understand that the antibody test doesn't necessarily mean that you are immune. If IgG is present, we know typically IgG antibody indicates that you are, generally speaking, indicates immunity. However, this is a new virus, and we are not telling people that because you have IgG, you are certainly immune. We are telling people that means you have potentially been exposed to COVID-19 before, most likely been exposed. So anybody who has that guidance in regard to returning to work, needing an antibody test, they should reach out to Public Health for further guidance in regard to that.
Great. Okay, we got all three of us. Any questions from you guys?
So Jerry, it's great news with the announcement of the CFED Gene Expert machine. Can you just explain to people, is that something that, how does the testing work with that? Would you need the same kind of supplies that you currently use, or do you have testing kits that come with it, and will there be an issue with the supply on those?
No, at this point we have adequate swabs, so it's a nasal swab process, and our lab director, Randy Mullen, has done a great job working supply chain so that we have those items coming in. He's also ordered an adequate number of reagents so that the analyzer is able to do its job.
Okay, so I think Ryan said at the beginning though that there was the problem with testing, or the issue with not testing as many people, was because of the lack of swabs and supplies. So
we are meeting the need right now, so and we haven't had the analyzer. So by definition, you had a limited number of people you could test because everything was being sent to a reference lab. For us, this will allow us to test the next level of person, right? And that will be those who will have operations. And then when Ashley gets the guidance for surveillance, we'll be able to incorporate those folks in. And between now and that time, our materials management staff will continue to work on making sure we have adequate swabs, and the lab director will make sure we have adequate reagents. So right now, there's no indication when we have this machine that we won't be able to meet the need.
okay, and with this new piece of machinery, it's not just for COVID-19 testing, so in the future you'll be able to do other kinds of diagnostic tests with it?
Yeah, so the way rural hospitals work is there are certain tests we can do in-house, and then there are other tests that we send out to reference labs. So with this machine, or this analyzer, you have me using words I shouldn't be using. This analyzer, we'll be able to do STD testing in-house, MRSA, and Group B strep. Although in the past we've had to send those out.
Can you start using it immediately, or is there going to have to be a buffer day?
Yeah, it's basically you trial the analyzer, and so we're going to have a few days of trials just to make sure it's calibrated correctly. So it'll come in the week of May 11th. It'll get set up. We'll get the right number of cases to trial and make sure it's calibrated correctly, and then it's full steam ahead.
And do you know how many tests it can be doing per day, maybe?
I don't, but I can certainly follow up on that one.
Yeah. It's not the most vital piece of information, just my own curiosity.
Yeah. The turnaround time is 30 to 45 minutes, so we'll be able to do a number of tests a day.
And then, do you know anything for sure that could be taking the back seat to make room in the budget for this analyzer?
No, haven't really spent a whole lot of time on the capital budget. The way capital budgets work, just from a pragmatic perspective, particularly in healthcare, you build these budgets. I instituted, when I arrived, a 10-year capital planning budget process. And so in theory, each year, you should be able to refine the current fiscal year's capital budget. So you have a pretty good idea of what will be ordered and you build the budget accordingly. But there's always something that comes up where something isn't purchased or there might be a change in service. So I don't know today what that will be, but let's just say none of that occurred and we spent every nickel. I suspect the Board of Managers will be okay that I bought this unit.
Not going to be huge.
Yeah.
If I can direct a question to Ryan quickly, can you just make a statement as to how having this type of machinery or analytics, whatever the correct term would be, having this type of analyzer is going to be really key in keeping Lewis County residents safe and controlled?
Sure, as long as I don't have to talk about IGGs and IGAs. So what's important going forward when we start looking at, how do we reopen our economy and reopen our community? This is going to be a long-term process where testing and tracing become extremely important. So in order to keep this community safe, even into the next 18 months maybe, 2 years maybe, we're going to have to be testing a wide variety of people, like Jerry was saying, and actually surveillance testing, so that we are keeping an eye on the virus in our community. And then when it is identified, we can isolate it and make sure that it doesn't spread. And that's how we're going to have to go forward here for some time. And so having a piece of equipment in the county that allows us to know the results of a test in 45 minutes is going to be very important to that, because it's going to allow us to test more widely, test more quickly, and then identify those trouble spots and isolate them. So that's why it's important.
And are you going to be able to test more often, or is the number of tests going to stay the same?
I'm not an expert on that.
It will increase.
Do you have any type of idea of like maybe 50% increase or like double it, something along those lines?
Well, as Ryan said, the goal set by the governor is for us to have about 800 tests a month. And we've done 328 tests to date since March 12th. So it's increasing significantly.
As the governor has been introducing the Unpause plan over the last few days, so we just have some questions for, I guess this is best for Ryan. So he's kind of saying that some regions are going to be able to unpause beginning on May 15th in a slow, smart way. He's listed out different things, like he wants to know what the region's testing regime is going to be, what the tracing system is, all kinds of things like that. So obviously the North Country region involves more than just Lewis County. Are there any conversations going on right now with other counties and officials in the region for how you're going to meet these goals and present a plan as a region to the governor?
There hasn't been a lot, or frankly any guidance from the governor's office on that, as far as I know. I know that the counties are talking amongst ourselves because I'm part of that conversation. I don't believe that there's any high-level conversation happening, at least that I'm not a part of, between the local entities and the governor's office. So.
Is that something that needs to happen between now and May 15th? Or what is Lewis County's strategy for kind of easing into this unpausing after May 15th?
So we're going to follow the governor's lead, which we have done, from day one. I think that there is an honest effort to get some of these areas that can open quicker, to get them to open quicker. And I'm hopeful that, that conversation will begin shortly.
The governor also mentioned with Unpause, and I think of us every time considering the snort scare and what have you, but even once you're unpaused as a county, to not have any events or things that invite a large number of outsiders and encourage people to come. But our whole tourism infrastructure is set up for that. So how would we unpause and at the same time not encourage people to come from far away?
So every time we've talked about, this virus, we've talked about it as a curve up and a curve down. So even when we started into the pause, it was, 25% reduction, then 50, then 75, then 100. I think that reopening is going to follow that same curve. So it's not going to be all at once. It's going to be slowly, and it's going to be as we are able to monitor, test, and trace. That's going to inform us on what we're able to do to, open things one at a time.
I was more speaking to, I get that, and that makes sense. But there are some things that even now, where nothing is supposed to be happening, we have a hard time enforcing and monitoring. As far as people returning, I mean, the county acted immediately and gave guidance: if you're up here, stay home, quarantine, what have you, please do not infect us. But I mean, the governor made a point to say, even with what you're talking about and how it will work in stages, don't have events or don't do things that encourage people to travel or come from distances. But I mean, that is when we reopen our stores or restaurants or whatever it is, that is what they need to survive. So specifically for Lewis County, I get the curve, but how do you get people not to come, since really where they're coming from, they're still surging, or they're higher on a curve, let's say. If you see what I mean. They have many more cases, it's more prevalent than it is up here. We're ready to open, but are they ready to be somewhere else?
So Lewis County is not going to be able to do that on our own.
Right.
This is going to have to be a regional, statewide effort to control those types of flows, because it's not going to work if there's a different set of rules in Lewis County than there are in Jefferson County, than there are in Oneida County. Because people other than us that work in government and care very much about the county boundary lines, the average citizen doesn't much care whether they're standing in Lewis County or Jefferson County. They're going to go where they can get the service and the experience that they want. So it's a good question. It's a thoughtful question, but it's not something that Lewis County is going to be able to answer on our own. It's something that we're going to need regional and statewide support on in order for that to be effective. Now, we've spent an awful lot of time and energy and money trying to get more people to come to Lewis County. So we don't want to lose that momentum, but we have to understand that this time right now is different, and there will be a time again when we'll work just as hard to bring people back. So.
What's preventing these regional conversations from happening already? Like, why isn't this being discussed? How are we as a North Country going to move forward and start to meet some of these guidelines that the governor has put forward?
Well, Lewis is one of the smallest counties in the region, so even if things start moving forward, they're not going to call us first. We'll be part of the region, but we're not going to be the leaders by any means. But that right now, all we have we have an executive order from the governor saying we're on pause, and we have a set of 12 checkpoints that we have to hit to reopen. Now, all the conversation about regional reopening has been wonderful, and it's exactly what we want to hear, but there hasn't been much movement on that. We've seen other regions of the state, the governor has appointed a regional czar, reopening czar. The lieutenant governor was assigned to Buffalo. The ex-lieutenant governor was assigned to the Finger Lakes. We haven't had anyone, put in a leadership position in the North Country, and I don't have a good answer for that question. I don't know. I don't know. It's a large area, and if the state is serious about a regional reopening, then I think they need to start getting serious about having those conversations.
And it seems like there's a lot of regional committees forming at different levels. So obviously you have the state working with other states, and there's a big committee formed there about reopening. I saw yesterday Congresswoman Stefanik has put together a coalition of NY21, which it falls into different regions. So you have part of it is North Country, part of it's, do these committees make sense? And is anyone from Lewis County represented on any of these committees currently?
So the RADC is one, regional entity that is already in place that works on economic development on a regional level. Obviously, Lewis County plays a role in that. But yeah, I don't know, Nick. Those are questions that we're trying to get answers to. The state is talking continually about a regional reopening, but there's very little evidence at this point that I have that much has been done to advance that. So that said, I'm the county manager in Lewis County of 27,000 people. I am not privy to every conversation that's happening across the North Country or in Albany. So there could very well be things happening above, my pay grade. I know our chairman, Larry, has been involved in conference calls, with the governor's office and with his fellow chairman in the region. But, I don't know how serious. I don't think they've been incredibly serious, frankly. So
I can speak to the local health department perspective. We, around the state, work well with our other local health departments, and we have, as the 7 counties identified in this North Country region, come together, and we'll start to meet regularly to discuss guidance that we will give, having a consistent voice, because public health will be looked at for answers in regard to how to reopen safely. So that conversation is starting to happen.
And it sounds like when unpausing starts that there's going to be, and you guys already touched on a little bit, but a testing regime in place and things like that. So obviously public health would be deeply involved in anything. If companies need to clear their employees before they come back to work through a test and things like that. So I guess that was one of the questions of, are we going to be able to meet that demand when this all starts to happen? Because you're probably going to have all the companies coming to you at the same time. Hey, we're ready to reopen. And
I think it's important to note that it's not all at the same time. Reopening is going to be a slow phased approach. So I think the way that I'm thinking about it is we will slowly be able to meet that demand as it arises. And obviously working with our local businesses and even on a regional basis to make sure that we meet the need as best we can.
But like even with the very first phase of unpausing, they're talking about construction and manufacturing. So, yeah. I mean, those are some pretty large industries in the county if you have to fit in testing all the people in those industry at one
right time. I think it's important to note that our manufacturing has continued to operate. So testing as a condition for them to return to operation isn't going to be a factor. Now construction is another. I haven't heard of any conditions on that. We have a lot of small contractors here. So I mean, we'll take it as it comes and try and plan accordingly.
Jerry, yesterday, Haney's announced, the Hospital Association of New York State announced that Lewis County General Hospital would be getting $1.537 million approximately through the CARES Act funding that went through with the Paycheck Protection Program that was passed.
Okay.
Now I know that you guys, I think you said in March your loss was right around $1.5 million. So
Yeah,
do you know if this money earmarked specifically for only COVID-related expenses, or can it help you offset what you've lost due to COVID?
It will help. All of our losses are driven by COVID. In the last couple of weeks, we've talked about surgical activity. Once that was taken from us, it fundamentally changed the volume of work, and it's those delivering units of healthcare that generate the revenue. So, it was 1.9 in March. It'll be somewhere between 2.2 and 2.5 in April. So it just helps to replenish, the loss. The hospital proper was not eligible for the payroll protection program. We have one employee in the foundation that was approved, and then our physicians are in a limited liability corporation, and so that was approved. But we haven't seen any resources arrive to support those operations.
There's supposed to be a next, Schumer and Gillibrand were on a nonprofit call.
Right.
And they were talking about the next phase. They've been fighting for hospitals and they won that war, I believe they said. So when that happens, if it happens the next round or the round after of stimulus, will it be nice but too late? Will you be digging down, or when it comes it will make it possible to bring people off furlough, it will make it possible to get back to operations?
So, we hear a lot about these stimulus programs and, how they'll help us locally. Pragmatically, we apply for everything we can apply for, but it is not a smooth path from Washington, D.C. to Lowville, New York. So we are not being overwhelmed with the largesse of Washington. But when it does arrive, when you're running the operating losses that we are, it will clearly help us get closer to break even. But I've read nothing or have heard nothing on press briefings where Washington or New York will make us whole. In fact, I think there's a storm brewing that COVID has prevented us from fully appreciating, and that's as we go down the curve. There are going to be some significant cuts, I believe, coming both out of Washington and Albany for healthcare. And I also think that the broader economy and consumers are going to be dealing with tax increases at all levels of government. And so disposable income becomes smaller. So, pretty soon we do have to transition to life after COVID. So I know at the health system we've been talking a lot about transitioning to the new norm and normalizing how we approach our work day to day. And as part of that normalizing, we have to think about the responsibilities associated with running fiscally viable, fiscally sound operations, which means we're going to have to start being more attentive to budgets and how we address the shortcomings. Nearly every sector of the economy is drowning in red ink seems a bit dramatic, but the red ink is getting bigger, right? It's growing, and we're going to have to develop our own version of an austerity working budget to navigate probably the next 6 to 18 months. Would you say that?
Well, yeah. I mean, in terms of the county operations, we're dependent upon the community. There's no secret where our money comes from. It comes from you guys. And when folks here are out of work and stores can't be open and transactions can't happen, that means that sales tax is not being paid. And so yeah, there's no doubt that tough times are ahead, which is why it is extremely important, so important, that the federal government step up and provide assistance to local governments. If this were a hurricane, if this were a tornado, or any other natural disaster, which is what this is, a virus is a natural disaster, there would be aid for local governments. To date, Lewis County has received $60,000 for assistance at public health. That's it. The federal government has bailed out large corporations at an astounding rate. They've had money for small businesses. They've had money for schools through the CARES Act. They've had money for individuals who are out of work. There's been nothing for local governments and hospitals that are on the front line of this. I mean, some for hospitals, but truly nothing for local governments. And we've been on the front lines of this from day one. So that needs to become a priority in Washington, because it doesn't matter what level of government it is, whether it's state, federal, or local. The money still comes from the same place. It comes from the people. And we can't run, a huge deficit in 1 year responding to an emergency, and not have any any slack picked up or any assistance from the state or federal level. You know, there's other parts of this country that have not been hit as badly as New York has. And, you know, when those places are hit, like when, you know, we have hurricanes and Hurricane Katrina and whatever else, you know, New York steps up and helps. And this is a natural disaster that's hit our state, and we need help, you know, the same way. So that, to me, that's where the assistance needs to come from, is from the federal level. So.
A question that we get quite often on the daily COVID testing updates, and I was hoping Ashley could help explain this to people. Can you just explain the difference between isolation and quarantine?
So isolation is our positive cases. We're isolating them away from others in their home. Quarantine is individuals who are at risk of having COVID. They're not yet confirmed of having COVID. And those are individuals who have had contact with positive cases or individuals that we have tested but don't have results yet.
I guess the question is, what does each entail? What does an isolation entail versus a quarantine?
Basically the same thing in regard to what people do. The only difference being contacts of positive cases monitor their temperature and symptoms twice a day, and we check on that. We also check on symptoms, though, of individuals in isolation and individuals that have been tested, just because, you know, they're home. This is a healthcare professional calling and checking in on them. So it's just the formality of what we're calling it, and also the distinction in the public health order that these individuals sign.
And I know last week, Ryan, you put out a call for the mask makers in the county, and we see a couple of additional distributions got added to this week's schedule. So can you just address how the community is responding with donating the mask, and how still getting a steady stream of them coming in?
Yeah, this community is astounding. I mean, the amount of people that have taken their time to sew protection for their friends and neighbors is unbelievable. And we have distributed at this point, by the end of the week, we'll have hit over 2,000 masks. We got an additional large quantity from Hanes, which donated masks to New York State. So, you know, we're gonna, as long as we have masks, we're gonna continue to hand them out. And I think it's just one of those things that we want to try to get as many people as possible to be doing the right thing. You know, wearing your mask protects your neighbors, it protects your friends, it protects your family. So we want to people continue to sew. As long as they're sewing and sending them in, we're going to be distributing them out to the community. So it's been a heck of an effort. I mean, what county, if we've got 30,000 people and we've put out, you know, 2,000 masks, what county has hit, you know, 8% of their population with masks? That's pretty good. So I'm very pleased with that, and thank you to everybody who's taken the time to do that, and keep up the great work.
Okay, so we should plan on a new distribution
yeah.
schedule for next week.
Yes. Yep. We've been going to grocery stores, convenience stores. You know, people have ideas of different locations that we need to hit. You know, let us know. Call in. So yeah, we'll make it. We've been, you know, Port Light into Harrisville, Copenhagen to Krogan. You know,
Yep.
we've really tried to make sure we hit every part of the county, and we'll continue to do so.
Good, thank you.
I'm all set.
Thank you.
All right, thanks.
Thanks, everybody.